but in a psychiatric way. So most of us are in delusion. Most of us are means realizing what is delusion. So delusion is what? It is a false belief. It is not true. They don't have any evidence of that, but it is a false belief. Okay, so it is common symptoms seen in psychotic disorder, mainly usually schizophrenia. Okay, so a delusion is a belief that is false. It is held with wrong, strong conviction. It is not expected by others in the same culture and cannot be changed by logical reasoning or the evidence. So example, a patient believes that government is secretly spying him from the hospital equipment. One more example is that a patient believes that they are famous celebrity in the hospital. Okay, and a patient thinks others are trying to harm or are jealous of him. So these are the examples of delusion, and we can see this type of examples in our reality also. So most of are in our classes also. So types of delusions are persecutory delusion. Believe that someone is trying to harm them or follow them. Most common type in all of us. And grandiose delusion. A belief of having exceptional abilities, power, wealth or fame, like they are celebrated. Okay. Then comes the delusion of reference. They are like a patient is thinking that any news or anything for in the TV or newspaper is specially for him. This is one of the delusion. Then comes the somatic delusion. In this delusion, what happens? A patient or any person thinks that he is having so much disorders in his body or his body is faulty enough. Okay. Then comes the jealousy delusion. Most of the people have this. That means they think the people are very jealous of them because they are very much great, like celebrating only. Now, conditions associated with delusion are schizophrenia, bipolar disorder. During manic episodes, we can see the bipolar disorder, that is dual personality also. We can see delusional disorder. Then comes the severe depression, and so with psychotic features also we can see. Then comes our importance for physiotherapists. Why? Why we physiotherapists need to learn about the delusion in psychiatry? Because delusion can affect patient cooperation and treatment adherence. Because of patient behavior, some treatment can resist the flow of the treatment. Okay, so patients may refuse therapy due to such suspicious beliefs. So they argue with the doctors. The patients argue with the doctors. They can't communicate calmly. They focus on the patient's feeling and provide reassurance. So we need to learn delusion in psychiatry to cooperate with the patient. So delusion is a fixed false belief. We can't cure it. But the patients with the delusion, we want to cure them. That's why we are learning delusion in psychiatry. Okay, thank you so much.